You are at increased risk for heart attack or stroke if you have high cholesterol levels, high blood pressure, or if you smoke. The presence of any single risk factor doubles your risk. Having two of these risk factors quadruples the risk. And if you smoke, have high blood pressure, and have high blood cholesterol, your risk increases eightfold. This certainly makes you think. This is the first in a series of 3 videos focusing on simple changes you can make to lower your cholesterol, your blood pressure, and help you quit smoking. The foods we eat play a major role in keeping our cholesterol levels low. The best part is that you don't need to put tons of restrictions on your diet in order to see positive changes. Making a few tiny improvements can yield significant reductions in LDL cholesterol, or the bad cholesterol. According to a study on the effects of food on your cholesterol, an easy first step to lowering your cholesterol may simply be having a bowl of oatmeal for breakfast. Barley, oatmeal, and brown rice have lots of soluble fiber, which has been proven to bind to cholesterol molecules in the small intestine, preventing them from entering the bloodstream. Try switching out your regular pasta for the whole grain version, or use brown rice instead of white rice. And to give your breakfast an added cholesterol-busting kick, top your morning oatmeal with high-fiber fruit, like bananas or berries, and maybe a bit of honey for taste. One bowl of oats per day may result in a 10% reduction in your cholesterol levels in just 4 weeks. The next step is to add foods such as nuts, avocados, fish, and tomatoes to your diet, as they work like soluble fiber. Only about 20% of the cholesterol in your bloodstream comes from the food you eat. The liver makes the other 80% out of saturated fats and sugar. Saturated fats are usually solid at room temperature and consist of foods such as butter, cheese, the fat in meat, and coconut oil. French fries also contain high amounts of saturated fats from the oil they're cooked in. If you love the crunch of fried food, use an air fryer for a lower fat fried taste. Or bake potato wedges at a high temperature until they're golden brown. Cookies, cakes, and pastries are made with large quantities of butter and sugar, making these high in cholesterol too. You might want to try stevia instead of sugar. Stevia is about 100 to 300 times sweeter than table sugar, but it has 0 calories, carbohydrates, or artificial ingredients. A recent study showed that the consumption of stevia significantly decreased the levels of LDL cholesterol, but increased the levels of HDL, which is good cholesterol. You may be wondering whether changing your diet will make a difference. Here's the evidence to prove it. An interesting multinational study compared the diets of countries with low and high heart attack rates and studied Japanese people who had migrated to Hawaii. These people had adopted Western dietary habits, so their diet contained more fat than the typical Japanese diet, but not as much as the typical American diet. The study shows that the Japanese people in Hawaii had higher rates of heart attacks than those in Japan. And interestingly, the Japanese people who migrated to San Francisco went even further in adopting American dietary habits and had, therefore, rates of coronary heart disease similar to Americans. I hope this video has convinced you that it is the amount and the quality of the food you eat that determines your cholesterol levels, and not solely your genetics. One of the quickest ways to reduce your blood pressure is by limiting your sodium intake. A study investigated the effects of sodium on 3,000 participants from 2 Portuguese villages. One village was given information on how to reduce their salt intake, and given processed foods with half as much salt. The other village was given no advice on diet. There was a significant difference between the villages in terms of blood pressure 1 year later, and an even greater difference at 2 years. If you also want to decrease your blood pressure by 2 to 4 points, try incorporating the following advice into your daily routine. The most common thing I hear when I talk to patients about a low-sodium diet is, "I don't add any salt to my food, so I'm already eating a low-sodium diet." It may be surprising to hear that only 10 to 15% of your average sodium intake comes from the salt shaker. But where is it all coming from, if not the shaker? The answer is pre-made processed food. Frozen pizza is just one example. A single slice of pizza can contain a whopping 980 milligrams of sodium. And who eats just one slice? It's even more astonishing if you know that the daily recommended amount is only 2,300 milligrams. When buying prepared meals, look for those with less than 600 milligrams of sodium per meal. This is the upper limit for a meal to be considered healthy. Always read the nutrition facts on food packaging to check the sodium content. Those chicken noodles that taste so good when you're sick can actually pack a punch of sodium. Soups can contain 500 to 1,000 milligrams of sodium per serving. Salad dressings also contain a ton of sodium. An interesting fact: high sodium content is why sauces last so long in the fridge without spoiling. The good news is that sodium levels vary significantly between brands and varieties. Many food companies are already following this consumer trend, so making simple swaps can help you avoid excess sodium. Additionally, cooking at home allows you to control the amount of salt added to your meals. Use sodium alternatives, such as garlic, citrus juice, or spice blends, to replace or reduce the salt you use. Returning to our pizza example, a homemade pizza contains only 453 milligrams of sodium, reducing the sodium content by half. Don't be put off by taste. All it takes is 3 weeks of consuming less salt before your taste buds acclimate. It's up to you whether to make the change. Tip 1. Consider nicotine replacement drugs. Nicotine is the primary addictive substance in tobacco that makes quitting so hard. Cigarettes are designed to rapidly deliver nicotine to your brain, triggering its reward system and providing pleasure and euphoria. As nicotine stimulates parts of your brain over and over, your brain gets used to having nicotine around. Over time, nicotine changes how your brain functions and makes it seem like you need nicotine just to feel okay. When you stop smoking, your brain gets irritable. As a result, you might have difficulty concentrating, have strong urges to smoke, or feel generally uncomfortable. Nicotine replacement therapy works by replacing some of the nicotine you used to get from cigarettes, so you don't feel as uncomfortable after quitting. Nicotine patches and gums are the most common medicines for quitting smoking. Nicotine replacement therapy triples your chances of quitting from 2% to 6%. Step 2. Preparation is the key. Nicotine replacement therapy only handles the physical dependence. You'll need other methods to help with the psychological dependence. Tell your friends and family that you're trying to quit. They can encourage you to keep going, especially when tempted to light up. You should also avoid alcohol and other triggers. When you drink, it's harder to stick to your no smoking goal. Likewise, if you often smoke when you drink coffee, switch to tea for a few weeks. If you usually smoke after meals, find something else to do, like walking, texting a friend, or chewing gum. Tip 3. Remember that time is on your side. You get immediate health benefits as soon as you quit. After only 20 minutes, your heart rate goes back to normal. Within a day, your sense of taste and smell will start improving. And in just 2 to 3 weeks, you will begin to lower your odds of having a heart attack, your lung function will improve, and you'll experience less coughing and shortness of breath. In the long run, you will also lower your lung cancer risk. And finally, try and try again. Quitting smoking is a process. Research suggests smokers make an average of 30 attempts before successfully quitting. Be patient with yourself and celebrate each small success along the way.